EKG, and they put the leads around the heart in kind of a clock-like pattern. And between two opposing leads that are 180 degrees apart from each other, that's an axis, and it'll record the electrical activity across that axis. And each of the 12 leads look more or less like this. Some of them are inverted, some of them are straight like this. And an expert in EKG can read a lot from the different leads, and I'm in no way, shape, or form going to try to teach you that because I don't understand it that well. So it records the electrical activity across the heart. It doesn't actually tell you what the heart is doing as far as contraction. It just tells you that it's conducting action potentials. And it'll tell you the different leads will tell you which regions are conducting action potentials. We assume, due to excitation, contraction, coupling, that when the heart passes action potentials, that it will contract. But you'd have to do other types of measurements to make sure it's actually contracting properly. Like you would actually have to put a barometer in the blood vessels to record the pressure there. Now that's really what we're doing with a blood pressure cuff. We're looking at the pressure that the heart is generating. So that's an indirect pressure measurement. But there are tools that you can put through a blood vessel and through a cannula that you can do endoscopically, where you can put a barometer into the heart itself and record the pressure in the different chambers directly. So this tells you about electrical activity, not necessarily the contraction, which we assume comes after. All right. What we're seeing here, the entire length that's right there, you can see the timeline down below, is less than a second. Okay, so that's about 0.7, 0.6 seconds. So this is one cardiac cycle, is what we're looking at. So somebody at rest, we just did blood pressures and pulse rates and heart rates, so maybe 60 beats per minute. 60, this would be 0.8, so that's going to be about 72 beats per minute, somewhere around there, about 70 beats per minute, resting heart rate. So what you see in an EKG is three different deflections, they call them. We have this small one that begins the cycle called a P wave. And then we have a compilation of three different waves called the QRS complex, QRS. And then we have another positive deflection called the T wave. The P wave, as it says here, that correlates with the depolarization of the atria. And where would depolarization waves start in the atria? Specifically, what structure? Where would depolarization of the atria begin? It's a structure we learned in lab. The SA node, okay. So the SA node firing is the onset of the P wave. That's the depolarization at the SA node. And then the rest of the P wave is the depolarization traveling through the right and left atria. Okay. Where do the action potentials go after they go through the atria? What's the next stop? Not yet. It has to go through a gateway first. You're right, it is going to go to the bundle of His, but where does it go before it does that? It goes to the AV node, right? It goes to the AV node, which is that kind of medial inferior border of the right atrium. And there it's delayed a little bit. We actually see that reflected in the EKG as well. There's a little flat spot right there between the P and the beginning of the QRS complex. It's actually flat right here. And that's, like it says here, that's the P to R interval. That flat spot represents the AV node, where it's delaying the action potentials a little bit, 0.1 seconds, before we continue on. Now from there we go to the bundle of His, and down the right and left bundle branches to the Purkinje fibers, and all of that is of course within the ventricles. So what we see now is depolarization of the ventricles, and that's this very tall peak here. The QRS complex is depolarization of the ventricles.
So this gram is just one heartbeat?
Yeah, less than a second occurring here. Okay, so atria and then ventricles. And so what we're seeing here is lub, dub. Okay, that's the heart cycle. Those are the heart sounds. We'll talk specifically about the valve sounds in just a second. Okay. So the QRS complex or the ventricles depolarizing. What should happen immediately after the ventricles depolarize? They should
repolarize.
They're going to repolarize. In the meantime, they're going to contract. Okay? They're going to depolarize, contract, and then repolarize. The ventricles are so large that part of the ventricles they've actually finished contracting and they're repolarizing, even while another part of the ventricle is still depolarizing and starting to contract. It's just there's so much tissue there, which you can have an appreciation for now having looked at the pig heart. That's a lot of tissue. So this QRS complex is the beginning of ventricular depolarization, and it extends all the way down through S. And then there's this little period right here where it again becomes flat, This is diastole. This is when the ventricles are electrically relaxed. Okay, they're not depolarizing anymore. And then to T, that represents, the T wave represents ventricular repolarization. It's a fairly broad peak compared to the P and the QRS. This diagram doesn't really show it, but the T wave is a couple of times longer than is the P wave. And that allows for the size of the ventricles. T wave is a little bit broader and longer. So what I expect you to be able to label, if I give you an EKG tracing, which will look like this, you should be able to label the P wave, QRS complex, and T wave, and tell me that P wave is atrial depolarization, QRS is ventricular depolarization, and that T wave is ventricular repolarization. Make sure you can label those. Right. We call the segments, it's like little naming any line. You just start with main point, end point. So you got the ST segment, Q to T segment, P to R interval, and you have a T to P segment too, which isn't listed here. So let's think about what should ordinarily happen. After the atria depolarizes, the atria should contract. Why do the atria contract? What are they trying to achieve when they contract? Why do the atria contract? To do what? To push the blood into the ventricles, right? Okay. So one of the things we'll repeat several times, and I've said it before, is that the ventricles mostly fill passively. So they don't depend on the atria to pump blood into them. The ventricles just fill because of the blood that's sitting there in the venous return, just waiting to go into the ventricles when they relax. So generally, we say the ventricles fill passively about 2/3. Active filling is when the atria contract. Now here's an important point. The atria have to finish their active filling, the pumping of that last third of the blood in, before the ventricles start contracting. Because otherwise we're going to enter into a tug of war, where the ventricles are contracting and the atria are contracting, they're going to fight each other. Now, having looked at the pig heart, who's going to win that battle? The ventricles, okay? Which would mean we would regurgitate the blood back into the atria. So in order to make sure that doesn't happen and the ventricles can fully fill, we have to delay the action potentials a little bit, and that's really the function of the AV node. Delay the action potentials going from the atria to the ventricles to give the atria time to finish contracting. So in the P to Q interval, what's happening there is the atria are contracting and pushing the blood into the ventricles. We delay it a little bit before the ventricles start contracting so that we allow them to fill completely. So then the QRS complex, the ventricles depolarize, and now we're going to pressurize the blood for ejection. So during this period, the atria are actually relaxed and repolarizing. You might look up there and go, well, I see atrial depolarization, I see ventricle depolarization, and I see ventricle repolarization. Where's atrial repolarization? It's there, but it's happening at the same time the ventricles are depolarizing. So it's hidden, okay? If you took out the peak, you'd kind of imagine a trough here, couldn't you? Right? Well, that trough would represent the atria repolarizing, but it's hidden, it's masked by the much larger depolarization of the ventricles, so that's why you don't see it, okay? So it's not that it doesn't happen, it's just not visible.
What about atrial repolarization?
Atrial repolarization would be a trough right here.
Oh, that's okay.
Okay.
So QRS is ventricles.
The QRS is ventricular depolarization. Happens at the same time as atrial repolarization. Okay. Since we don't have a way to tell them apart, you get this as the net effect. Okay, so then QRS, we depolarize the ventricles. Now the ventricles should contract, and that's what's happening from Q to T. From Q to T, that represents systole. That's when the ventricles are contracting. And one of the things that I had to learn looking at this is that systole continues about halfway through T, and this doesn't really show that very well. But systole goes from here all the way to about halfway through the T wave. So the ventricles, they continue to contract even while part of them have completely repolarized, again, owing to their size. So during ventricular systole, we're ejecting blood. So that period of ejection is going to go halfway through the T period. And then after that, this is diastole. From T all the way back to P, that's diastole. So the T to P period, that's when the heart is actually relaxed. There's really no electrical activity going on there. Both the atria and the ventricles are relaxed from T to P. And then we start again. Okay. That fairly straightforward?
Mm-hmm.
Okay. And then they're breaking that down here for you, just like I did. Here's some tracings. I'll come back and show you those. This you should recognize from lab. Okay, so those are the auscultation points of the valves. That's figure 18.2 if you want to take a look at that. You know, it's cut off the top of my screen for some reason. So I want to get to this chart, because this chart represents an essay question on your exam that everybody has to do. Okay?
And what chart is this?
Figure 18.21. This is the correlation between EKG, ventricle pressure, ventricle volume, and heart sounds. Those four things. Okay? EKG, ventricle pressure, ventricle volume, and heart sounds. Now, unfortunately, my EKG tracing to the top is a little bit cut off. So on this one, what I give you on the test, and I expect you to fill in the rest, is I give you these vertical lines. See the white line there, and then this division between the two oranges? There's lines there. Okay, I give you those vertical lines. And I give you the EKG tracing here. So there's a P wave, QRS, T, and the P, QRS. Like I said, it's a little cut off. But can you see the landmarks there? That's P, here's the QRS, and there's the T. All right. I'm sorry that the labels are missing. So I give you those lines, and I line it up with the EKG up above, and you have to label the peaks on the EKG. So you have to label P, QRS, and T, and tell me what they are. And that's the first thing. And sometimes students miss that one. So that should be an easy one. So you tell me atrial depolarization, ventricular depolarization, ventricular repolarization, right? Okay. Then it gets a little tougher. Then you have to sketch in these lines, okay? And you have to fill in the axes. So let's just look at pressure for a minute. Now the pressure graph, in this graph they're showing you 3 different pressures. You only have to show me one. So let's separate it out so we can see what's being shown here. They're showing you the pressure in the atria, and that's this reddish line here. They're showing you the pressure in the aorta, which is the green line. You don't have to know those two, okay? They help explain what's going on, so it's a nice teaching tool, but I'm not going to ask you to reproduce those on the test. So the pressure in the atria and the pressure in the aorta, you don't have to show me. But the blue line, that's the one I'm interested in seeing. That's the pressure in the ventricle. Okay. Now, I'll give you some advice about the right way and the wrong way to approach this question. Okay. The wrong way to approach the question is try to memorize that line and draw it perfectly. That usually fails. Because you're on a test, you're nervous, you're rushing, and you just, even if you did it well in practice, it tends to, you get something a little bit off and then it's not perfect. The right approach is understanding when the pressure should be high and low, and then just connecting the dots. That's the right approach. Okay. Now, don't look at the chart for a minute, okay? Look down at the floor, close your eyes, look at your neighbor, whatever, and think about the question I'm going to ask you. Then look at the chart. When should the pressure in the ventricle be high? When should it be high?
Depolarization.
What's that? Someone, I heard an answer over here first.
Depolarization.
Just after depolarization, right? Excitation, contraction, coupling. So, yeah, just after depolarization. What's another way of phrasing that? What period is that? Yes, that would be systole. That's systole. Okay. All right. So now, sticking with what you said, just after depolarization. So we should look up at our EKG and find the QRS complex, and just after the QRS complex, I should see the highest pressure point. That's what I should see. So let's find that on the graph. Okay. Here's the QRS complex. Here's pressure. Well, look right there. There's the highest pressure point. Okay. Now we'll discuss why it's an arc here in a minute. But there's the highest pressure point, just a little bit after the QRS. It shouldn't be right at the QRS, because that's right when depolarization starts. And contraction comes just a little bit after that. So there's a little lag there. Okay, so that makes sense. Let's think about, so now look away from the chart. Okay. Now think, when should ventricular pressure be the lowest?
Repolarization.
Yeah, towards the later end of repolarization. After we've contracted, we're repolarizing. Now remember, early repolarization is actually happening even while the ventricle is still contracting in other parts. So later repolarization, between that and before we start a new cardiac cycle. So in other words, diastole. We would look in the diastolic